Okay, so this little presentation here is just a quick little talk about good technique versus bad technique. Sometimes I feel like we need to remind each other that this is cosmetic medicine, this is aesthetic medicine. So we want to make the patient very comfortable. We don't want to, like we were mentioning earlier, we don't want to drip blood or do anything like this. So what you can see on the left is an example. This is another example, okay, and you could see how they're resting their finger on the person's nose, all right? That's, if you ever had that done, it's a little bit uncomfortable, it's not necessary, so try not to do that, but you do want to stabilize your hand, so that's important. You could see this picture on the right. This is I think, very good technique because they're pinching the glabellar region. All right, so you do want to pinch that muscle and you do want to go directly in, so that's kind of important. And one thing that we have to practice, I'm going to try to explain it to you in a lecture here, but one thing that's important, and that's why I have this model over here, is we want to practice doing this injection with your stabilizing your hand and your finger, okay? So what I'm talking about is, let's say this is the person right here. If you just go in like this and you have your hand on their head, you're not going to have the stability that you want. So we have to practice what I'm talking about a little bit. You're going to go in like this. What you want to do, and dentists are very, very good at this, by the way. Are there any? Nobody's a dentist here, right? Dentists are very, very good at this. You want to create more stabilization for your hand and for your finger and for the injection. The way to do that is to rest this finger and this hand on something, okay? It could be your other hand. It just has to touch it like this. Or what I usually do a lot is I lock these fingers in place like this, and this hand is on the person's head, okay? Just doing this, you're going to see it creates tremendous amount of stabilization. All right, so typically you're going to come in, all right, and you have your needle and you're kind of moving around, and the patient sees this too, and obviously they're uncomfortable. So you can't inject the person with one hand. It's not a one-handed technique. You need that second hand. All right, the second hand could be anywhere. It could be up here, and you could inject like this. The other thing that I do commonly is when I'm injecting the corrugator muscle, I go like this, squeeze it, then the pinky rests right on the thumb. Can you guys see that okay? And you're going to practice it right now. So this is tremendous. I can hit a dot exactly like this. I am not moving. I will never miss like this. So you're pinching it, but your pinky is resting on your thumb, okay? Again, don't rest it on the corner of their nose like this. Some people do that, but you have to practice it. There's a couple different ways to do it. You could do the pinky, you can lock your fingers, you could put your finger tip up here. There's a lot of different ways, but you have to stabilize this hand, and the way to do that is by touching something else. All right, and we'll practice. Thank you again very much.